Good morning, good afternoon, and good evening, everyone. Thank you for joining us for day 2 of the National Academy of Medicine's Healthy Longevity Global Innovator Summit. My name is Michelle Toplitz, and I am the Program Director of the NAM's Global Grand Challenge in Healthy Longevity. We had a fantastic day 1 yesterday and had the opportunity to hear from many awardees with such diverse projects, made possible in part through their receipt of the Catalyst Award. Today, we look forward to another exciting lineup of innovators and spotlight awardees who've experienced success, particularly in obtaining additional funding for their work. We have a panel of awardees from around the world speaking about their projects that help combat social isolation and strengthen mental health for healthy longevity. And finally, we'll do our wrap-up and celebratory session as we publish the names of the global winners and hear about what's next, including the $1.5 million grand prize coming in 2026, so please stay with us. Without further delay, allow me to introduce my colleague Tricia Teo from Singapore's Ministry of Health to give us a sense of their Catalyst Award program. Tricia, the floor is yours. Thank you.
Hi, good morning, afternoon, and evening to one and all. I'm Tricia from the National Medical Research Council, and I'll be representing the Ministry of Health Singapore in this presentation. So just a little background of NMRC. So the National Medical Research Council was established in 1994 as a funding arm of the Ministry of Health Singapore. So effective 1st January 2024, the NMRC office, which supports the NMRC, has moved under the MOH Holdings as Division of Research and Innovation, with no change to NMRC's role, vision, mission, and functions. So the role of NMRC are to oversee the planning, the development, and advancement of biomedical research in Singapore, particularly in the public healthcare clusters and medical schools. We also engage in research strategy and planning, provide funding to support competitive research grants and core research enablers and infrastructure. We are also responsible for the development of clinician scientists through awards and fellowships. So the NMRC office and Ministry of Health Singapore co-administer the Healthy Longevity Catalyst Awards under our Healthy and Meaningful Longevity Funding Initiative. We have launched a total of 6 grant calls for the Catalyst Awards since 2020 to provide seed funding to catalyze transformative ideas and innovation to advance healthy longevity. And a total of 257 applications were received and 57 projects were awarded across the 6 grant calls. So this graph shows the number of applications, awards, and success rates across the 6 grant calls. The key aspects of Singapore HLCDA is that we are open to teams representing public or private sector institutions across all disciplines. This allowed us to see interest beyond our usual research community or partners, but also amongst community care providers and industry players. We also emphasize to applicants a list of emerging priority areas that were of importance for Singapore. This has encouraged participation from diverse disciplines, fields beyond health and biomedical sciences. So we have increased the funding quantum from $50,000 to $150,000 per project from 2023 grant call onwards to attract more interest within the research community. So with the increase of project quantum with no change in the available budget, we can see that fewer projects were awarded from the 2023 grant call onwards. So Singapore's priority areas for the Catalyst Awards have evolved over the years as we try to steer applications towards the desired topic areas, while the final funding decisions were still based on the quality merits of the proposals. So in the first phase of HLCA, in 2020 to 2022, the priority areas are biology of aging and molecular pathways, healthcare delivery, housing and the built environment such as assisted living models, etc., technology, productive longevity such as technology or job redesign solutions, social sciences, as well as financing. So from 2023 to 2025 onwards, cognition was prioritized to align with emerging priority areas of aging in Singapore. Applicants are encouraged to explore multidisciplinary themes, such as the tuning of cognition as the main topic focus area with other disciplines or subjects like technology, social sciences, productive longevity, housing, and environment and financing. So the graph here shows the breakdown of 257 applications we have received over the 6-round course. So while we continue to see applications from a wide range of organizations, including academic institutions, public healthcare institutions, and research centers, the majority of the applicants comes from the academic institutions. So this proportion has remained consistent across all the 6-round calls. For the success, challenges and successes, since the 2021 grant call, we have consistently emphasized on topics which are important for understanding of healthy longevity, as well as multidisciplinary proposals. This has helped to encourage more diverse and multidisciplinary proposals that are beyond the typical biomedical science research projects. So in fact, for the awardee spotlight shortly after this presentation, our invited awardee will be sharing about his exciting work, which cross disciplines with cognition and technology. Yeah, so as for the challenges, we find it rather challenging to sustain interest for the HLCA. So it is noted that for the last grant call received, we received the lowest number of applications. So possible reasons for this decline could be due to other aging-focused grant calls launched within the same year. So I'll now hand over the presentation to Mr. Lim Jie-en from SingHealth Polyclinics, who will be telling us about an interesting VR tool the team has developed. He's presenting on behalf of the lead PI who is unable to attend this event. Mr. Lim, over to you.
Hello. All right. Yeah, thank you, Tricia, for the wonderful presentation. All right, so my name is Mr. Lim Jie-en. I'm a research officer from SingHealth Polyclinic Singapore, representing Professor Tan Yap Chuan, who is the director of the Research and Primary Care Research Institute, and also the SingHealth Polyclinics Research, and also SingHealth Duke NUS Family Medicine Academic Clinical Program from Singapore. Yeah, so firstly, I would like to thank the National Medical Research Council of Singapore, Ministry of Health, and also National Academy of Medicine of the US for providing us this opportunity in the HLCA. Yeah, so the presentation today, the topic is it's named as evaluation of the validity, reliability, and acceptability of a virtual reality system in assessing cognitive function using mixed methods. Okay, so to start, I'll just give a brief introduction. Yeah, so as most of you probably know, the current testing for mild cognitive impairment, or MCI, mostly relies on using questionnaires. Yeah. However, this kind of tests, they may not always show how well the individual can function in their everyday life. And this is actually termed as the ecological validity. Yeah. So this kind of pen and paper test, for example, the MOCA assessment, they actually rely on the input from the individual, from the assessor. However, this kind of approach, it may not always strongly match how the individual actually functions, when they are in their home or community environment. Yeah. So interestingly, over the past few years, virtual reality or VR has been used in cognitive assessment. However, most of the existing VR tests are only limited to assessing 2 to 5 out of the 6 cognitive domains, which I'll explain in the next slide. And moreover, these tests have yet to be tried extensively in primary care setting, which is actually the first point of contact where most individuals having risk of cognitive impairment are actually seen. Yeah. So as mentioned just now, MCI is actually the stage of pre-dementia, and the early symptoms of dementia are actually not that obvious. Yeah. So these symptoms they actually vary from person to person, and it can appear in one of the 6 forms as outlined by the DSM-5 criteria. There are 6 cognitive domains, namely executive function, complex attention, language, learning and memory, perceptual motor function, and also social cognition. Okay. So just to introduce you to the technology that Singha Polyclinics from Singapore has developed. In short, it's named as CAVIA, which stands for Cognitive Assessment Using Virtual Reality. So basically, it is a digital-based cognitive assessment across 13 different virtual reality scenes. Yeah. And there is an automatic scoring algorithm based on the individual's performance in the VR and also their completion time for each of the scenes. Yeah. So each VR scene actually consists of virtual tasks which simulate the common activities of daily living, which I will present in the next slide. Yeah. So how do the individuals actually perform this VR assessment? So basically, this assessment, it involves multi-domain inputs. For example, using the hand, head movements, and also using their speech. Yeah. So in this VR assessment, along the way, the VR assessment actually provides automated visual and voice instructions in English to guide the user. Yeah. So besides English, our team has further developed the Chinese and Malay language versions so that they can cater to the local multi-ethnic Asian population. Yeah. So CAVIA is actually a virtual reality assessment, and it can be completed in less than 15 minutes. In fact, most individuals actually complete them within 10 minutes. Yeah. So for each the VR scene, the participants, they are allowed multiple attempts to complete the different tasks within the specified time limit. Yeah. So based on the automated scoring matrix, the first correct attempt will actually gain the highest possible score. And if the participants actually require more attempts, that will actually give them a lower score. And once the time limit exceeds for a particular scene, they will automatically proceed to the next scene. Yeah. So as mentioned just now, CAVIA is unique in a way that it is actually designed to assess all 6 cognitive domains as specified by the DSM criteria. So as you can see here in the table below, there are 6 cognitive domains and there are 13 different VR scenes which are in CAVIA. So as you can see here, each scene actually assesses one or more cognitive domains, and that's how we actually have a comprehensive way of assessing the 6 different cognitive domains. Yeah. So this is just a brief summary of the 13 different scenes in case you are wondering. Yeah, so it starts from like a daily setting in the person at home where they are in the washroom, just waking up, brushing the teeth. Then the next one, if you can see in the picture here, it's they're just going to the kitchen to prepare their breakfast. Then they'll just go out and do some activities along the way, which actually simulate their common daily activities. And the last picture we can see below is actually where the participant is at the shopping center and they're actually purchasing the fruits based on their memory. Right. So thanks to the HLCA award, we are able to conduct this research study to evaluate the validity and reliability of CAVIA as a VR assessment tool to distinguish individuals who are cognitively healthy from those who have MCI across the 6 cognitive domains. Yeah, so in this study, we actually recruited 280 multi-ethnic Asian adults who were aged between 55 to 84 years old. And basically the study is each individual will come for 2 different visits. And during the first visit, the participants actually complete the MOCA assessment and the caviar virtual reality assessment by separate assessors in order to avoid bias. Then subsequently, we compare the scores by the MOCA and also the scores by the caviar in order to evaluate the validity of caviar. Yeah. Then during the second visit, a number of participants, 100 participants actually returned to repeat the same caviar virtual reality assessment so that we can evaluate its reliability in assessing cognition. Yeah. So just in short, reliable tests will actually produce similar scores on both occasions. Yeah. Okay. So the study has been completed and the findings has been published, which I will share in a later slide. But essentially, the study findings show that the caviar has the ability to assess the 6 different cognitive domains, and also it demonstrated its validity to distinguish cognitively healthy adults from those with cognitive impairment. And based on the results, the area under the ROC curve, it's 0.88, which is actually quite good, as the AOC value of more than 0.80 actually indicates that a particular tool has good ability to distinguish between adults with a particular disorder and those without, as in those who are healthy. Yeah. So secondly, caviar also demonstrated its reliability to assess cognition. And the participants completed the caviar assessment during the first and second visits. And based on the results, it shows that there is good test-retest reliability with intra-class correlation coefficient of 0.89 and also good internal consistency with a convex alpha of 0.87. Yeah. So in short, caviar has shown to have potential to be a harbinger of older people to take on preventive measures to sustain their cognition in primary care and in the community. Yeah. So next, I would like to share the publication that our team has managed to have in recently this year. And as you can see here in the slide, we have managed to publish this paper in virtual reality, which is under the Springer Nature board. And the link is here, and I'll briefly show the QR code up here. For those who are interested, you may scan the QR code to get access to the publication. It is open access, so you can download the PDF whenever you want. Yeah, I'll just leave this slide here for a few seconds for you to scan the QR code. All right, so I will proceed now. Yeah, so besides having a publication in 2025, our study team also managed to have a media release very recently, and it was published in the local news outlets. Yeah, as you can see here. Yeah, in the photo, we have one of our participants actually coming back to join the media release, and in the middle there, gentleman there with the purple tie is actually Prof. Tan, who is the PI of this study. Yeah, and I'm the person in the second from the right and second from the left, and the person on the left is actually the person from the VR company who is actually helping us to develop the VR software for caviar. Yeah, so yeah, so we have completed the study, and so the next step, we are actually commencing on interventional trial using digital intervention to support the cognitive and physical health of adults after using caviar to identify their cognitive status. Yeah, so we will leverage on this trial to assess caviar as a monitoring tool so that we can track the progress of the individual's cognitive health over time. Yeah, so at the same time, we also have received some interest from local as well as foreign entities for potential collaboration and commercialization. Yeah, so so like to thank the audience for tuning in to watch our presentation, and if you have any interest in collaborating with our team on caviar, yeah, feel free to contact Prof. Tan, as you can see here on the slide. Yeah, Prof. Tan is actually from SingHealth Polyclinics, and we are all from Singapore. And I'll leave this slide here, and thank you so much.
Thanks so much, Tricia, for the illustrative presentation on Singapore's Catalyst program, and also to Lim for sharing your work with the cognitive assessment using virtual reality tool. We really appreciate it. It was fascinating. I could see how this would have wide relevance and potentially broad-based impact given the prevalence of Alzheimer's in the global population. So now we'll transition to a short break. Please stay with us and we'll be back soon.